scared to leading the care team that once stood at her bedside. We sat down with Sarah Putman, the Director of Women and Newborn Services at Community, to learn more about what led her to pursue a career in labor and delivery. All right, Sarah, thank you so much for joining us today. We really appreciate your time and, just being here and telling us a little bit about your journey and career.
Oh, well, thank you for having me.
Yeah, so, okay, let's talk a little bit about how did your career begin? Where did you initially find this purpose and sense of passion for the industry that you're in today, and how did it bring you to Community?
My first experience was I was going to Fresno State University in the nursing program, and they asked me where would I like to do my clinical rotation, and I thought what I really want is the most well-rounded experience. I wanted to take care of all different types of patients, and so that's when I said to my nursing program, I want to have my rotation at community medical centers.
What has that been like for you, just reflecting on that journey?
Well, it's been amazing. So during my clinical rotation, I actually had an opportunity to become an extern while I was still in nursing school, and so I started that externship here on a med-surg area, GYN patients, and I started there, and here I am 40 years later.
And how has your role also changed from where you started and to where you are today, and how has that also just tied into your journey with Community as well?
When I graduated from the nursing program, I knew I wanted to work here. Growing as a new grad, I quickly found that I wanted primary care versus team nursing, and so I got into labor and delivery in 1986. I think one of my key things in my professional career is I always loved what I would call positive challenge. Like, boredom was not good for me. And I think that's why labor and delivery was so perfect for my desire to always feel like I was challenging myself and growing.
Let's talk a little bit about, I know you've had your own personal experience with antepartum.
I was too early to safely deliver, but I had some significant issues with the placenta and the growth of my baby. So they hospitalized me for 10 weeks. It was eye-opening and stressful, but so beneficial. Not only did I come out with a healthy baby, which is amazing,
yes.
But it really broadened my perspective of how important what we do is every day.
I'm so glad that everything went smoothly, and
and my son,
you're healthy.
He's 26, and he is an RN here in the neonatal intensive care unit now.
Congratulations!
So
you must be so proud.
It's full circle, right?
It is full circle. Oh my gosh, Sarah. Well, thank you so much for sharing a little bit about your journey. I mean, so inspiring, and I think it's incredible that your drive is being this amazing leader. So thank you so much for your time.
Well, Community is a great company to work for, and I'm very, very thankful that I've had this opportunity.